Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Today's card trick is called Do As I Do. Probably one of the simplest card tricks you'll ever see in your life, but it's all about the presentation. If you present this right, it looks like a real miracle. Now I've got my over-the-shoulder camera here that's going to look at these two decks of cards. Now since I'm here by myself, I don't have somebody to do as I do, but I'll explain as we go along exactly what happens. First thing you do is have both of you shuffle the cards at the same time. Mix them up thoroughly. You can shuffle them as much as you want. It really doesn't matter because this is a fair shuffling of the deck. Now remember, at this point all we've done is shuffle the cards thoroughly, and they honestly have been shuffled. There's no secret, no trick here so far. Then we're going to have each of us at the same time cut the cards. And then we're going to take one card, look at it, place it on the other pile. Then we complete the cut. And now we're going to cut the cards again. Same thing, do as I do. And you could even cut them in groups of 3 if you wanted to, as long as you're doing the same thing. And once you've done that, once again, you switch the decks back. You say, keep doing this, do exactly as I do. I want you to look through your deck of cards and find the card that you selected. And so I'll do this by looking through my deck. And the card I selected is, and the other person at the same time is looking through their deck of cards, and they will find the card that they selected. And once you've done that, you go back and explain and reiterate everything that's happened up to this point. Remember, we both shuffle the cards, we exchange decks, then we fairly cut to a random point. We memorize the card, then we cut it back together, and then we shuffled it and we cut together a bunch of times. Then we swapped decks again, picked out the card we chose. You picked out the card you chose, which is a 7 of hearts. The card that I selected, also 7 of hearts. Now, when I explain to you how easily this is done, you're just going to freak out. Here's the secret. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Okay, before we get into the formal presentation on diagnosis that I prepared, I'd like to read you a quick email that I got from a Dr. George Spader. And he says, I really enjoy the root tips of the week. Thanks, George. I appreciate that. Very helpful. Looking forward to attending a root camp in the near future. My question is, what do you use to check for thermal response? I use Endo Ice for cold and have tried different things for hot, like thermoplastic beads and gutta percha. What are your recommendations for this? Thank you in advance for your time and for the root tips of the week. Well, George, let me read just a little bit of the response that I wrote in the email, and then I'll amplify that just a little bit. It says, hi, George, I use Component Cooler from Radio Shack for cold testing. It's the exact same stuff as Endo Ice, except it's half the price. And all you have to do is turn the can upside down, because Component Cooler is just basically air that sprays out, but the propellant is a liquid, and it's the identical material as you find in Endo Ice. And all you have to do is turn the can upside down. It's really a spray that has a liquid propellant if you turn the can upside down. So P.S. spray a loose cotton pellet, not a Q-tip, because the Q-tip is wound too tightly and you will not get good results by doing it that way. I had another doctor, Dr. Shaw, who also asked me about hot and cold testing, and he was a little bit more specific. He said that he likes to squirt hot water with a syringe on the teeth that he's working with, and I agree with that. I think that's a wonderful idea, but the problem is, unless you individually isolate every single tooth that you're working on with the rubber dam and then put the hot water on it, take the rubber dam off, move it to the next tooth, add more hot water, you're not going to really get an accurate reading because the hot water spreads to the adjacent teeth. Here's an idea. Why not put the rubber dam on if you like, and put some hot water in there, or without the rubber dam, doesn't matter. But then, instead of trying to isolate one tooth at a time, just squirt it in the general area and say, is that the pain that you've been feeling? Once you create the pain from the heat, go back and take your loose cotton pellet, spray some Indo Ice or a component cooler on it, and begin touching it to the teeth until you find which tooth stops hurting when you put the cold cotton pellet on it. And that way it's a lot easier to reverse it, to stop the pain and pinpoint the exact tooth that you're treating, rather than just try to isolate one tooth at a time with hot water. Now let me give you a few other tips. I'm going to just boot up my computer right now and get a few other diagnostic tips that may help you. And so I'll be right back in just 1 minute. Now, I don't know about you, but I've never actually had a patient come to my office and said, you know, Doc, it really hurts when I put an electric pulp tester on tooth number 13. So that's not the first test that I'm going to use. The patient tells me that it hurts when they get cold or when they get hot, and we've just talked about that, or when they bite down or whatever the patient tells us. That's what we want to do to try to duplicate their chief complaint. There are several questions you should ask the patient when you first start your examination. Number one, does the pain wake you up or keep you up at night? If the pain is so severe that it wakes the patient from a sound sleep, you can be certain that that's an irreversible pulpitis case. Is there any thermal sensitivity? Do hot or cold things bring on the pain? Almost every tooth that needs a root canal has a history of thermal sensitivity. Very important to ask those questions. And finally, what about chewing? Does it hurt when you bite down? Or actually, even more important, does it hurt when you bite and then the pain is worse on release? That's almost pathognomonic that it's a fractured tooth. And here are a couple of quick clues that the pain might not be caused by a tooth itself. No hot or cold sensitivity, chronic pain, dull aching that lingers on, pain in the temporomandibular joint region, history of depression, taking antidepressant medication, and multiple previous doctors. If that patient has been going from one office to another, probably the problem may not be the tooth itself. It could be other things that you have to check into. And the very first thing you should examine is their bite. Could this problem be caused by occlusion? Now, when I was in dental school, I was told that there was no way that poor occlusion would kill the root or cause the tooth to become non-vital. We now know that bad occlusion can, in fact, cause that type of sensation. Transillumination is also a great way to check for cracked teeth. The light will not cross the crack, so as you see in the photograph in the lower left-hand corner, the tooth is illuminated, and then there's a black line, and then it's darkness beyond the crack. Cracked tooth, should you do a crown, should you do a root canal? I think the most important thing to remember is how long has the tooth been painful. If it's been a long duration, maybe more than 3 months, pretty much you can assume that that nerve is probably going to fail. Many times it's very difficult to diagnose whether or not the tooth is cracked or not, and the transillumination will help a lot, or sometimes the tooth sleuth will help, but many times you can just push on the tooth and you can get that little movement and see it's cracked. Lingering pain indicates irreversible pulpitis. We mentioned that briefly before. Vertical fractures, and sometimes there'll be a halo radiolucency around the root. There may be a periodontal defect, and there'll be horizontal percussion rather than vertical percussion, causes more pain in many cases. This is a good example of the halo radiolucency, and I think it's pretty obvious from the film that fracture in the first place. Treatment for this, of course, is solarization, where you expose the root tips to sunlight. Another possibility might be sinusitis. Multiple maxillary posterior teeth would be sensitive to percussion. Many times the patient gives you a history of a recent cold or sinus problems in the past. The pain might also change with the patient's posture. And finally, I'd like to leave you with one last suggestion. Never trust a fistula. A lot of times it's going to be 1 or 2 teeth on either side of where the draining fistula is. And in those cases, if you'll just put a medium-sized gutta-percha point up in that draining fistula, it doesn't hurt the patient, and it'll point right to it. So your goal in duplicating the patient's chief complaint is to make them say, yes, that's the pain I've been experiencing. Diagnosis doesn't have to be a big mystery, and I hope some of these tips have helped you out. If you have any more questions, please send me an email. We'd love to hear from you. And that's it for this week. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp. So long for now.